premium of $134. It can be higher for individuals whose income is higher. They may pay more. It could be less if people's income is enough lower where they may not have to pay part of that premium too. So those are all dictated by income guidelines that are set by the federal government. And we have those guidelines, so if people had questions in regards to that, we have those charts and numbers, okay? They actually just recently changed last year, okay? And what it does is it covers all your outpatient and medically necessary needs, including preventative services, and it has a $183 annual calendar deductible. So just like Part A, Part B kind of moves on its own, so they're like two separate pieces, and Part B has its own deductible, which is $183, and then typically after that, the beneficiary is responsible for 20%, okay? And there's no cap on B. So it's not I pay 20% so I get to this number and then they pay 100. On Part B, you pay 20% of everything, okay? So they work, they're the same on the same card, but they work differently. Part A is your hospital, and then Part B is your outpatient services. So there's two pieces to what they call original Medicare, A and B. Yep.
I'm going to ask you, when did that $1,340 deductible start per period of benefit? When did that start?
You mean how it was that way?
No.
Or just the actual number?
How long has that been? Because I was in the hospital, I didn't get charged that.
Did you have a additional secondary coverage?
I do have secondary.
That's probably why.
So they covered that.
Yep. Yeah, and what we're doing today is what I want you guys to do is kind of bring awareness to I want you to bring awareness to what original Medicare is, and there are solutions to help what we say cover these gaps, right? And we're going to talk about a couple of those solutions and how do we cover the gaps of original Medicare so that way I'm not charged 20% on like a $100,000 bill, right? We want to know how do we avoid that situation. And that's what we'll kind of talk about today too as well. And the other thing too is, which is not as common but can be, is excess charges. There is a potential for a 15% increase in excess charges because there are still a few doctors, few and far between, but there are still a few doctors out there who do not accept Medicare assignment rates.
So I'm not sure.
Yeah, go ahead.
That 15%, I mean, 15% of what?
Of what the assigned rate, which is it's in addition to what that they can charge a premium of 15%.
Charge a premium?
Yeah, like an additional cost to the beneficiary. It's like an extra of a medical law amount, yeah.
If your primary doesn't accept Medicare?
If your primary doctor didn't accept Medicare assigned
But
rates.
if you go to a different doctor who doesn't
Yeah, you could go to a different doctor.
No, I mean, if you go to a different doctor who doesn't accept Medicare rates,
Yeah.
it's not going to be the same, right?
Right. Yeah, it's not gonna be the same. Yeah. And it, like I said, it's very uncommon. It can happen, but it's very, very uncommon that that's a situation with doctors. But there are some doctors out there that work on different services and different fees and things of that nature. Okay. But yeah, it's something that you don't run into very, very often. That's for sure. Now, here's some of the things though that are not covered under original Medicare. Okay. And these are kind of important because, things like acupuncture, I know that has become more and more popular in some of the alternative health measures, right? Chiropractor services, unless it's a correction, okay? Custodial care, as we mentioned before, long-term care, nursing home, assisted living, those things are not covered under original Medicare. Dental care is not covered under Medicare, and that includes obviously dentures and root canals and things of that nature are not covered by original Medicare. Hearing aids, routine vision and glasses, except after a cataract surgery. So cataract surgery would be covered by original Medicare, and then you would be eligible to buy or to get glasses after that surgery, but not if you just wanted to go in there for a routine type visit. prescription drugs is not covered under original Medicare A and B, so we're just talking A and B. And then any emergency medical care outside of the U.S. and also life insurance is not covered by Medicare. Okay, so those are some of the topics that are not covered by Medicare. Now, Part D, as we mentioned, oh, do you have a question?
I just wanted to
Yep.
comment on
Yeah.
chiropractic services. That's really not true, because basically chiropractic, as the patient or the person gets older,
Mhm.
and they're, even 60s, 70s, and that's what the chiropractor is going to charge, is subluxation. As a matter of fact, when he writes it up,
Sure.
he's going to say. So basically, that is covered. Chiropractic
Yeah,
is
well,
covered.
yeah, except for, right, you're right.
It is. They're
Yep.
going to write it up as that no matter what.
Well, of
When you go
course.
into the chiropractor,
We would,
he's going to
right.
do that. Absolutely.
Yeah, we would do
So,
that if we were
to say
chiropractor.
that and people get scared, I can't go to the chiropractor.
No, I know.
That's not true.
I know. It's silly though because they put it on the
I know.
Medicare.gov website. So, in doing something like that, we have to state it that way, But I would agree, it's kind of misworded a little bit, yeah, for sure. So, and then Part D. So if you're enrolled in Part A and or B, you are eligible for Part D, which we had mentioned before is the prescription drug coverage. Okay. Now you can buy prescription drugs as a standalone to original Medicare, and most Medicare Advantage plans will include prescription drug programs in their benefits. So when we talk about Medicare Advantage plans in a few minutes, a lot of those programs will include Part D as part of the package. Okay, so you don't have to buy a separate prescription drug program. You can get it with a Medicare Advantage plan. Okay, and we talked about the Part D late enrollment penalty. That was the 1% that they charge you if you go without prescription drugs. Okay, for a period of time. They may include a premium, or a deductible, depending on the level of plan that you get. And most of the Part D drugs will have different tiers. Okay, so and I think a lot of us, when we go to the pharmacy, may be surprised at times because drugs fall on what they call different formularies, which will have different tiers. So they're the tier 1s, the 2s, the 3s. And what happens is you sometimes go in and you're like, man, I didn't know this was a tier 3 drug. I'm paying a much higher copay than I do for most of my other prescriptions. And that's just because they fall on different tiers. Okay, so that's one thing that an insurance agent or insurance company or even a doctor can help you, is sometimes there are some alternatives or substitutes that are on different tiers.
Generics.
Yeah.
You just have to ask them.
You
for
gotta
a
ask
generic
them.
that's less.
Yep, because that's the biggest cost that I run into a lot with people that we help with Medicare, is I find that a lot of people are paying a lot or way too much money on their prescription drugs, and it's just because they don't really know how the plan works. There's a lot of moving parts. Yep. Yeah. What about it? Yeah. So I think in 2006, they passed the law that required all Medicare participants, as of 2006, would have to enroll in a Part D program, whether that be a standalone, whether that be a Medicare Advantage plan, whether you had it through your employer. I think one lady had mentioned she had it through her employer's group, or like VA, for example, would be considered prescription drug coverage, because I know a lot of men and women get their prescriptions through the VA.
So once I retire.
Mm-hmm. Yep.
Then I have 6 months to get Part D.
Yeah.
Supplemental.
Yeah, you have what they call an initial enrollment period. Yep.
60 days or 6 months?
3 months before your eligible effective date and 3 months after, which they call the initial enrollment period. Yeah. So when you retire, right, and not on Medicare.